Number 7, Honourable Annette King.
My questions to the Minister of Health. Will the total allocated funding for Vote Health and Budget 2014 be sufficient to keep pace with population growth, ageing and increased costs?
Honourable Tony Ryle.
Mr Speaker, the member will have to wait until tomorrow. But what I can tell the member is that the appropriation for health has gone up an average of $500 million a year under this government, which stands in huge contrast to yesterday's Australian budget, which is taking about $10 billion out of Vote Health there over the next 4 years.
Well done. Mr Speaker.
Order. Supplementary question, Honourable Annette King.
Was the Ministry of Health estimate of the shortfall in funding in the health sector operating allowance $376 million in Budget 2012 and $343 million in Budget 2013? If not, what was their stated shortfall in funding requiring efficiency and/or reprioritisation?
Honourable Tony Ryle.
Look, Mr Speaker, I'm not really sure exactly what those numbers refer to. The member would have to set them down in a written question. But what I'm quite confident is I can be able to say that our average $500 million increase in the appropriation has meant, budget on budget, we've been able to cover, particularly with reference to DHBs, the inflation and demography change.
Supplementary question, Honourable Annette King.
Does Vote Health require an increase of $499 million in this year's budget to maintain the current level of service, as stated by an economist yesterday? If not, has the level of funding recommended by the Ministry of Health increased or decreased from their 4-year budget plan?
Honourable Tony Ryle.
Mr Speaker, the member will have to wait until the budget tomorrow to see what the numbers are with respect to the 4-year outlook for Vote Health. But I'd have to say that this government has increased the appropriation by an average of $500 million a year. But actually, it's not just the amount of money that counts with respect to health services, it's what is delivered for that money. And we would stand on our record as opposed to another record, which is you double the health budget and have fewer operations, which is that member's record.
Supplementary question, Mr Speaker.
Order. Supplementary question. Supplementary question, Honourable Annette King.
Did funds from efficiency and reprioritisation by DHBs and Health Benefits Limited provide Vote Health with an additional $128 million in 2013, as stated in the Ministry of Health's 4-year budget plan? If not, what were the savings made in that year?
Honourable Tony Ryle.
Mr Speaker, I would have to check those numbers, and I don't have them here with me. But it's quite clearly that what this government does every year is we make sure that we get new money available for health, and we look at, for example, the lowest 0.5% of spending, and we make those savings available for spending the next year, because we actually think that we should continue to find those savings and provide more money for patients' services. That's how we have increased elective surgery by 40,000 extra operations a year compared to when that member was last in government.
Order. Supplementary question, Honourable Annette King.
How much in the funding in Vote Health 2014 will come from reprioritisation and savings made by Health Benefits Limited and DHBs, something he claimed would be $700 million in savings by 2015?
Honourable Tony Ryle.
Mr Speaker, I would reject the premise that that member is making, because that's certainly not what we've said. She will have to wait until the budget. And it is not, the member knows that finance ministers and all ministers can't give comments on the budget just days before it. That was certainly the case when that member was campaigning against Sir Robert Muldoon, Alan Hyatt and Merv Wellington.
A question now.
Mr Speaker.
Point of order, the Honourable. Order. Point of
Mr
order, the
Speaker,
Honourable
in
Annette.
light of the Minister's answer, which I'm sure you listened carefully to, he said he disputed that it ever claimed they'd make $700 million in savings. I seek leave to table a press report of in 2012 in the New Zealand Herald where he does make that claim.
Order. First point, if the member wants to seek leave to table, the member should stand, nominate the document and the date, etc., and then I'll put the leave without making the political point at the first. If it's a New Zealand Herald column, it's available for all members to research if they want it. Question number 8, Andrew Williams.
Thank you, Mr Speaker.